Hi guys, Alicia's so awesome. So I got a message the other day. I'm assuming from a new nurse because she left a message underneath my video asking for like my opinion. I'm gonna approach one now and then I'll approach another one probably Friday will be my next video. Okay, so her question was, how should a new nurse basically handle when they make mistakes and not let it become the best of them? And I'm going to tell you this, as long as you're a nurse, right, you're going to make mistakes. That's not never going to change, right? Ever. I've been an ICU nurse 7 years. Some people say, how you been an ICU nurse 7 years? You're a nurse practitioner. I am a nurse practitioner that still works the bedside. So I work 3 days a week in my NP job and currently 2 days a week in a cardiovascular ICU. Most months of the year, I don't work 2 days a week in ICU. I do at least one because I teach as well. I teach nursing students, and I feel like in order for me to stay up to par, I have to keep my hands on the bedside, if that makes sense. So I'm able to relate to my students and to help educate them the best way possible. Plus, FYI, if any of you guys are thinking about going back to school, the best nurse practitioners are the ones that have a very good grasp on the nursing bedside aspect. That makes them like a double threat because they're able to handle the bedside and they're able to handle the provider view. So anyway, so mistakes are going to be made until you stop being a nurse. That's not never going to change. What I want you to understand is when you get out of nursing school, what you're taught in nursing school is enough for you to pass your board. When you get out of nursing school, the real work begins because you're going to have to make sure that you're well versed in whatever area you go into. So I went straight to ICU. I was actually offered my job before I graduated. It declined actually. Said I didn't want to work there. I wanted to apply through another place. Luckily for me, the lady who offered me the job was still willing to give me the job, and that's how I ended up going to ICU. I was lucky to be at a facility that had all types. We had vascular ICU, we had cardiovascular ICU, we had MICU, we had neuro ICU, and we had SICU. So I was able to get all types of training. And I made more than a lot of mistakes. Even though I was very smart and I had to go through a lot of training before I was actually allowed to hit the floor as an ICU nurse. We had to pass tests. We had it was weeks and weeks of training, like 16 weeks on site and off site. I still made a lot of mistakes. So mistakes are going to come with the game. Always use your baseline knowledge you were taught in nursing school. You know what I'm saying? Always use the things that they teach you to guide your decisions. If you're confused, you have a provider to ask. If you make a mistake, you go home. What I used to do in ICU was go home. I had a book. I used to look up the things that used to confuse me in the book. And I used to make sure that when I came back the next day, I was better educated on what it was I was confused about the day before. I'm going to tell you something I used to make a mistake on. Sedation. I came out to, I would get my MICU patients would come vented, and they would sedate them. I was always taught you wean sedation. It did not dawn on me that you wean sedation while they're vented, right? Right. So if your patient comes out and they're on a fentanyl drip and they're also on a propofol drip, you want to wean them to an adequate RAS score, but you basically don't want them to be too sleepy, but you don't want them to be too awake. You want them to be comfortable. That's what wean means, right? You wean them so they're at a comfortable place, not too sleepy. Okay, so when I first extubated a patient, I did not know that I was supposed to completely cut all the sedation off, right? I was like, oh, okay, so my patient's currently on one of fentanyl, and then in 30 minutes I'll go down to a half mics, and then after that I'll cut it off. And it was a resident at the time, and he was like, what do you mean? I'm like, I'll wean the fentanyl, blah blah blah, whoop de whoop, right? He's like, she don't need the fentanyl, right? She's extubated, she doesn't need it anymore, she's okay. And it took me for such a loop because I always felt like wean. I had to go home and do some reading and figure out, once my patient is extubated, they don't need it, right? They don't need it anymore. I can give PO stuff if they've passed the speech eval, or I can give some other IV stuff, right? I was so embarrassed. I'll never forget this resident. I wish I knew his name. But I was so embarrassed. When I saw him the next day, I said it to him. I was like, I went home and I actually looked up in my book, like the parameters and stuff for sedation. And thank you for letting me know I should cut everything off as soon as my patient is extubated, right? The fentanyl should have came off as soon as my patient was extubated. Like, I kind of knew it in the back of my head, but I've been taught all this time to make sure I wean. I didn't put 2 and 2 together that I should be weaning the sedation while they are intubated. After they're extubated, they don't need, they don't need it anymore. And he was very welcoming and very happy to assist me in learning. But I can remember for a while I felt embarrassed, and then I was talking to my mentor, and my mentor was like, you ain't killed nobody, right? You had the sense to go home and to look it up, and now you know better. So that's what I'm going to tell you newbies that feel like you're consistently making mistakes. You're going to always have something that you need to learn, right? I could tell you guys story after story after story, right? So many stories, right? But I'm telling you that as long as you are growing in your nursing profession, you're going to make some mistakes sometimes. That's the only way you're going to learn. And the best way you can cope is to deal with it by educating yourself on what it is you made a mistake about, right? So for me, I had to go home and read the protocol and read up on the parameters for sedating the patient and the drips and all that stuff. That was my issue, right? For you, I want you guys to do it for whatever it is for you. You take the time and you go home and you read, or if you don't have I don't know where you guys are, like if you're on the floor or PACU or whatever, like you take the time to find somebody who does know well and who's willing to help, right? And educate you, and you ask them. The only thing I'm going to tell you that is when you're asking people to help you and asking people to educate you, make sure it's somebody who's an advocate for you and willing to help you. Because nurses have a tendency, these older nurses sometimes have a tendency to eat their young. Like, it is horrible. So a lot of new nurses don't feel comfortable asking questions because they feel if they ask a question, somebody's going to make them feel stupid or dumb or belittle them. And I know what that feels like. And I'm just telling you that if you're nurse educator, your nurse director, somebody on your floor that is well versed, in what your specialty is, you ask them to help you. And I'm going to tell you that when you go to people and tell them, I want to learn and I want to do better, a good-minded person and a good-hearted person and somebody who loves the game, the profession of nursing, is always going to be willing to help you. I have a mentor, her name is Vivian Abel. That's how me and her got extremely close. I used to go to her like, I want to be the best of the best. That's how I used to talk to her. Like, I want people to know that I'm a good ICU nurse. Make me the best of the best. You feel me? Educate me beyond measure, please. Anything you can help me with, please help. So to this day, she still helps when I have issues, when I have things I'm not 100% sure of, right? CVICU for me, I'm a 7-year ICU nurse. CVICU for me, this is the longest I've ever worked in the CVICU. There are days where I'm like, oh my goodness, I didn't know, right? I worked ICU. We're taught not to titrate vasopressin. Some cardiovascular surgeons titrate vasopressin. It was new to me, when I initially got to cardiovascular ICU, right? I'm like, you don't titrate vaso. They're like, yeah, on this unit, some of the surgeons do. So I'm going to continuously and constantly be learning, and so are you. Be open to the fact that you're learning. Do not be hard on yourself. You're not going to know everything. Even the nurse on your unit that say she's been doing it 20 years, she don't know everything, right? When you're a new grad, you bring a lot to the table. What you bring is fresh book. What's fresh out the book. All the fresh research. That's what you bring to me, the nurse who's been here 7 years, and I know the game, right? I know how this works. I know the rundown. I've been doing it a long time. So together we're a powwow, right? We're a powwow team because you're bringing the fresh new, and I'm telling you how to work this, right? Because I've been doing it. So don't feel insecure or out of the loop. Don't feel stupid or dumb, right? Just find you somebody that's going to help educate you and be on your team, somebody you can refer to when you're in a situation, in a pickle, and you don't really know what to do, but you want somebody to help you. When you make mistakes, take the time to go home and look it up and figure it out. Ask the doctor, ask the nurse practitioner, ask your buddy on the floor who is well educated in that, and just begin to become up to par. But don't never expect yourself to not make mistakes. Celicia's so awesome. Thank you guys. I will see you guys soon.